Bismillahirrahmanirrahim. Today in Health and Wellness, we are going to discuss women's health issues and we are going to give special focus on pregnancy. To start with, let's see what are the top 5 medical conditions that we see in a woman. Heart attacks, depression, strokes, lung cancers, osteoarthritis. And in addition to these, you may also see breast cancer and smoker's lung. We all know the importance of screening, and it is just as important when you are dealing with women. The screening tests that we conduct, we have already discussed it in our last chapter, but still I am going to reiterate some of their salient features for you. Blood cholesterol level, we do that in a fasting individual, and technically we look at the cholesterol levels, the triglyceride levels, HDL and LDL. ECG, you are very well aware of that thing. It gives a measure of your heart's condition. Chest X-ray, again, it is something where you look at the chest cavity, the lungs and the heart. Blood chemistry, it has a whole range of tests that we conduct, like liver function tests, renal function tests, in which you get urea, you get creatinine, electrolytes like sodium, potassium, chloride. I mean, there is a whole battery of tests which come under the chemistry label. Then CBC with differential. CBC is complete blood count and differential is the differential count where we look at the WBCs. Then the thyroid function test, in which there is the thyroid stimulating hormone T3 and T4. Transferrin saturation test, this is the test where iron overload is tested. Urinalysis, it covers a whole lot of ground from its physical appearance to its microscopy. Now, where women are concerned, there are 2 more tests which are very important concerning their health. One is the breast self-examination test, the other is the pap smear. Now, looking at the breast self-examination, a woman should be taught how to look at her breast, the abnormalities which she can identify, because the earlier we are able to diagnose a cancer, the better the cure and treatment is going to be. The things that we look for, any lump or thickening in the breast or the axilla, any modification in the size or shape of the breast, any change in the color or texture of the skin that is overlying the breast, any dumpling or puncturing of the skin, any abnormal discharge from the nipple, any scabbing or retraction of the nipple. These are all changes which are abnormal, and if a woman sees them, she should definitely consult a doctor. Now, regarding the pap smear, again, this test is a very important test, especially in women who are 35 years of age or more. Usually it's seen uterine cancers, they usually start from the cervix. In pap smear, we take a swab from the cervix and we look at it under the microscope. If there are any metaplastic or dysplastic changes, these are early indications of precancerous cells. The earlier the diagnosis, the better the cure. So this becomes a very important test, especially in women who are 35 years of age or more. Also, it is also able to identify HPV, human papilloma virus. Again, this virus is supposed to have high risk towards cervical cancer. Similarly, other risk factors which contribute to cervical cancer are HIV infections and weak immune systems, like where transplants are concerned, like where chemotherapy is occurring, or if there is chronic steroid use. Now we are going to look at the female athlete triad. This concept was basically built for the athletes. But now, with the evolving times, we have seen that women too are becoming conscious of their health, and we see them exercising from a mild form to even a very severe regime. But still, keeping in mind the athletes and those women who are on a very, very uh, robust sort of a exercise program, this is what we should look at. The thing that we have to consider here is that in athletes, uh, the exercise regime that they follow, it is usually a very tough regime. It has very strenuous exercises. It demands a lot from the body. And in return for high performances, sometimes the normal physiology of the body is disturbed. It is seen that in these women, there are hormonal changes which affect the lifespan of this woman. So the main, the main regulatory dysfunctions that we may encounter in athletes are anorexia nervosa and bulimia, amenorrhea and oligomenorrhea, and osteoporosis. Now we're going to discuss each one of them individually. Let's see anorexia nervosa. Anorexia simply means less appetite, or if there is loss of appetite. Anorexia nervosa, it means a person is not eating as she should. And what are they afraid of? They are afraid of gaining weight because the disciplines in sports in which they are involved, usually they require a certain weight range above which they cannot go. So to maintain that weight, they eat less, they are afraid to eat more, and in doing so, they damage their bodies. Bulimia nervosa, this is binge eating, or in this case, the athletes, they eat food in large quantities and then that is followed by vomiting or purging of the food. Now these both conditions are pathological and they do not benefit the athlete. In fact, they have adverse effects. They not only affect the athlete's performance in the field, but they increase the morbidity and even the mortality of the athlete. What we should do, foremost, these athletes need psychological counseling. Also, we must encourage them to eat normal, healthy food. And where needed, hormonal therapy is definitely indicated. Amenorrhea. Amenorrhea is where a childbearing woman fails to menstruate. In other words, a woman who has reached a childbearing age, usually this is considered between 15 to 49 years of age, and that woman does not menstruate. Her menstrual cycle does not start. Then we say that woman has amenorrhea. Amenorrhea can be of two types, primary and secondary. Primary amenorrhea is where a woman has never menstruated before, and The most common causes are delayed puberty, very thin girls, or very athletic girls. Secondary amenorrhea. This is where a woman who had a normal menstrual cycle fails to menstruate for 3 consecutive months. Then we call that female is suffering from secondary amenorrhea. A woman with primary amenorrhea has never menstruated before, but a woman with secondary amenorrhea was menstruating normally before, and then she developed amenorrhea, and that amenorrhea has to be for at least 3 consecutive months. Then we label that female that she is suffering from secondary amenorrhea. The most common causes are pregnancy, breastfeeding, menopause, genitourinary system pathologies, endocrine system pathologies, and other reasons like obesity, stress, strenuous exercises, and rapid weight loss. The thing that is seen is athletes who have a very thin build. Usually they are the most affected by these pathologies. But please bear in mind that exercise and physical activity does not cause amenorrhea. It is the very intense, very rigorous exercise regimes which cause these problems. If you are doing normal exercise, you are following a normal physical activity program, you are not going to suffer from amenorrhea. But if you follow a very intense and rigorous exercise program, then these are some of the problems which may be encountered by a woman. Oligomenorrhea. Oligomenorrhea means infrequent or very light menstruation in a female who had a normal menstrual cycle previously. And the most common causes in which oligomenorrhea may occur are chronic illness, tumors that secrete estrogen, poor nutrition, and eating disorders. It is seen that female athletes, oligomenorrhea is something which is quite common in them. And usually this oligomenorrhea is secondary to their restricted diet because they have to maintain their weight within a certain range. And it is also due to the use of anabolic steroid drugs because they have to build up their muscle mass, they have to strengthen their muscles, and for that they use anabolic drugs. Then strenuous exercise and hormonal balance is another two common causes which can cause oligomenorrhea, which is secondary feature where female athletes are concerned. Now, if you look both at amenorrhea and oligomenorrhea, the thing that we have to do is, foremost, we have to encourage them that they should start eating a healthy diet. The next thing is that they should bring the intensity of their exercise programs to a lower level. They should start following a moderately intense exercise program and come down from that rigorous exercise theme which they are following. The third thing they have to do is stress management, because athletes, they are under a lot of stress, and depending at the level that they are competing, the stress level increases multiple times. So stress management plays a very important role where a female athlete's health is concerned. And they should have a balanced lifestyle. They should not have unnecessary emotional stresses coming their way. So a well-balanced lifestyle with a well-balanced diet should be the choice of treatment that these athletes should follow. Osteoporosis. Osteoporosis is something because osteoporosis is considered a disease of the older people. But here, where female athletes are concerned, these women are fit, they are young, but they may still show signs of osteoporosis. And the reason is that the estrogen levels in these female athletes are compromised due to their rigorous exercise programs. So, to avoid these, they should have an increased intake of calcium, that is around 1200 to 1500 milligrams per day, along with at least 3 glasses of skim milk per day. If they are taking oral contraceptives, either they should reduce the dose or they should completely stop them, because all of these things, they compromise estrogen levels, and when estrogen level is compromised, it decreases bone density, because it is seen that estrogen levels play a very important role where bone mass and bone strength are concerned. And when estrogen is compromised, you will see that the bone strength, the bone mass decreases, which can lead to pathological or stress fractures. So the athletes have to be very careful, and they have to definitely supplement their diet with calcium and with milk to fortify their bone strength and bone density. Where needed, estrogen replacement therapy is also recommended, but still, diet and exercise regime are the best options that we can offer a female athlete. Now we come towards the pregnant woman. A pregnant woman passes through several stages when she becomes pregnant. There is the prepartum stage, and then there is the stage where we call the intranatal, where delivery occurs, where the baby is born. And then there is the postpartum uh, stage. So looking at the prepartum stage, when a woman conceives till the time of delivery. In the prepartum stage, for good health of the mother and the baby, exercises are definitely recommended because they improve the health of the mother. If the health of the mother improves, the health of the baby improves. So, to improve the mother's health, it is definitely advisable that the mother should undergo and join some exercise programs which uplift her health, not just physically but mentally also. Also, it is advised, when these women are put to exercise programs, the maximum heart rate that they achieve should be no more than 60 to 75% of what maximally they can achieve. This is a very important consideration. They should never be tested to their highest levels. When designing these exercise programs, and when these women come to you for their exercise programs, you should be very vigilant. You should look for any warning signs which these women might show, which may become a very big health hazard for them, like pain, vaginal bleeding, dizziness, numbness and tingling, shortness of breath, edema, headache, calf pain, swelling, any problem if they develop during their exercise program, that exercise should immediately be stopped and a doctor should be consulted. As we continue with the prepartum exercises, the three most popular and the most effective prepartum exercises are Kegel exercises, which strengthen the pelvic floor muscles and they prevent urinary incontinence. The other are the aerobic exercises. Here we take care that we start them with low impact aerobic exercises, or if they don't want to do aerobic exercises, they can do swimming or cycling or any other activity which is of low intensity and it is a non-impact exercise. The third most popular and most effective thing that they can do is walking. That is 3 to 5 days per week, and this has shown to be an excellent exercise because it does not need any sort of guidance or any sort of preparations. Now we look at absolute contraindications to exercise in pregnancy. Absolute contraindications mean that the woman is not supposed to exercise if she has any one of these conditions. And these conditions are pregnancy-induced hypertension. That means a pregnant woman is having a blood pressure over 140 by 90 throughout her pregnancy, because this blood pressure can further increase and it can change into preeclampsia. In preeclampsia, there is not only high blood pressure, that woman is going to uh, there are going to be proteins in this woman's urine, there is going to be toxemia, and there is going to be excessive edema. This condition can further lead to eclampsia, and eclampsia can have a fatal outcome. The other absolute contraindications are a woman who is a diagnosed case of cardiac disease. Then there is premature rupture of membranes, abruptio placentae. Abruptio placentae is where there is premature separation of the placenta from the uterus. Then preterm labor or a history of preterm labor. Then if there is a history of recurrent miscarriages, if there is persistent vaginal bleeding, if there is fetal distress, if you find there is intrauterine growth retardation, that the fetus is not growing at its normal rate, there is incompetent cervix. The problem with incompetent cervix is that the fetus can slip out of the uterus. Then there is placenta previa. Placenta previa is where the placenta covers the internal os, and during delivery it becomes very difficult for the child to be born. Then there is toxemia. Then there are the conditions which are related to liquor. Polyhydramnios, when there is increased quantity of liquor, or oligohydramnios, when there is decreased quantity of liquor. These are all conditions where a pregnant woman should not exercise. Now, if a pregnant woman who was normal and she was having a normal time and she started her prepartum exercises, then what are the signs, symptoms that she should stop exercising? Now, these conditions are if she develops pain, if there is suddenly vaginal bleeding, suddenly if uterine contractions start and these uterine contractions are coming at less than 15 minutes of interval, if there is persistent dizziness, numbness, tingling, or she has visual problems, visual disturbances, or she suddenly faints, there is shortness of breath, suddenly she develops tachycardia or palpitation, or there is continuous and persistent nausea and vomiting, there is leakage of the amniotic fluid, suddenly she feels that the fetal activity has decreased, there is generalized edema, there is severe headache, or there is some sort of a swelling or redness. If a woman develops any one or multiple signs and symptoms mentioned below, then it means that she has to immediately stop exercising and she has to be consulted by a physician. Because if we are not careful, these are conditions which can increase the mortality and morbidity of the female and the fetus. Now, what are the benefits of exercise? Everything is not bad, because everything that we have discussed till now, it seems that exercise can be very, very non beneficial for the pregnant woman, but that is not so. The thing is, exercise has a lot of benefits for pregnancies, and these benefits are: they increase the muscle tone, they increase the endurance, the energy level, they decrease tension and stress, they decrease the swelling, they improve the body posture and the body mechanics, they improve the circulation, and they strengthen the pelvic floor muscles, because usually weak pelvic floor muscles, they can lead to urinary incontinence or even slipping out of the baby. They decrease the discomfort and the pain. They give you a better sleep pattern. They prepare you for the labor and the delivery, and they improve your self esteem. By exercise, a woman becomes psychologically more strong and she is mentally more capable of giving a normal birth. Now we're going to look at the relative contraindications. By relative contraindications, we mean that a woman can exercise during pregnancy, but she has to be monitored continuously. You cannot leave this woman alone. You cannot tell her, okay, you can do all these exercises, and after you finish, you can come to me and we can discuss any problems that you might have. No, you have to monitor the exercise program of this woman, because these are the women who are at a high risk, but still they are maintained at a level where they can exercise and benefit for their health. The relative contraindications to exercise in pregnancy are: if a woman has multiple gestations, like she has twins or triplets or more than 3 kids, then if there is a renal or cardiac transplant, if she is a smoker, if there is a history of back pain, if this woman is suffering from fever or she is obese, or this woman is unwilling to exercise, or due to any reasons she is unable to exercise though she wants to exercise, if she is a patient of chronic hypertension, she has asthma, if she is working and her work involves strenuous work, if there is hot and humid environment, or she has acute infectious illness. In all these conditions, the woman can exercise during pregnancy, provided all these conditions are controlled. And all her exercise programs have to be monitored, because in case any of these signs symptoms appear, you have to immediately stop the exercise and take her to the doctor for consultation. Now we're going to look at the postpartum exercises. Once a woman has delivered the baby, now we have to bring her back to normalcy and full health. But you have to bear this in mind, that it is not okay the day you give birth to your child, immediately you start exercising and you start to maintain and you start trying to maintain your shape and your weight. No, you have to wait, you have to rest, and you have to get to know your baby. Once your body, after it has passed through all that suffering, all that what do you say, insult, that over the 9 months that body needs rest, and you need to get to know your baby and the baby needs to get to know you. So in the initial few weeks, you have to rest. You do not have to jump into an exercise routine. Now, the things that you have to follow is every person is different, every person is unique. So, the exercise program for every person is going to be different. There are going to be some women who can very easily adapt into an exercise program. There are going to be others who will have a difficult time adapting to an exercise program. And remember, when you are exercising, always inhale and exhale. Never hold your breath during an exercise. Also, when you are exercising, you have to support your head and shoulders with a pillow. And always gradually start your exercises. Never jump to those extreme levels in the initial stages. Gradually work your way up to your final destination. Now, the thing is that even after postpartum exercises, you have to be very vigilant and you have to be very careful because the some of the silent symptoms can appear which have to be considered, because then you will have to stop your exercise and you will have to go and consult your doctor. Like suddenly the bleeding reappears, or you start feeling pain, or maybe your asthma starts working up. All the contraindications and relative contraindications that we have discussed, some of them may resurface in your postpartum time. So you have to be careful, and if these develop, you have to immediately stop your exercise program and you have to consult your doctor. Now, the recommended exercises that are offered are foremost walking. These are this is an exercise, like I told you, it needs no conditions, needs nothing. You just have to get up and start walking. The other is leg bracing. Then the Kegel pelvic floor exercises, which we have already discussed. Then the abdominal strengthening exercises. In these comes the pelvic tilt, which strengthens your abdominal muscles and it relieves any backache that you might have. Then abdominal breathing. Again, this helps to strengthen your abdominal muscles. Then there are the ankle circles and the leg sliding and stretching exercises. Then another aspect that we have to see, that's the abdominal muscle separation. Now the thing is, during pregnancy, as the pregnancy enlarges, it stretches your abdominal muscles. Now you know that your abdominal muscles, technically, they are made up of two halves. And in the midline, these two halves are connected with a thin fascia. As the abdomen stretches, so does your abdominal muscles and so does this fascia. Now you have to see if there is any separation between the abdominal muscles. The easiest way to do that is to measure it with your fingers. If the gap is wider than 2 fingers, that means abdominal muscle separation has occurred. So we start doing abdominal strengthening exercises which will remedy this abdominal muscle separation. Then there are the arm and upper back stretching exercises. Then sit-ups, diagonal sit-ups and aerobic activity. All these exercises, they help you bring back your health, your strength and normalcy to your life. The thing that we have to consider is your back. It is one of those things, because backache is something which is associated with pregnancy. And after giving birth, we have to protect your back against any sort of injury or any residual effects that the pregnancy might have had. So there are a few suggestions which we offer you to follow. The thing is, do not carry your baby over your hip. This causes the spine to twist and it can cause misalignment. Then it is best that you use padded shoulder supports to carry your baby. Again, if you have to change the diaper of your baby, do not bend over the baby. You should sit down on the bed next to him and then change the diaper. When you are feeding the baby, you should support the baby, your arm with a pillow underneath it. And this will avoid any straining of your shoulders or anything, because sometimes there are women who lean in over the baby and then feed the baby. In this, there is rounding of the shoulders and the back is curved. So to avoid these injuries, we suggest that you keep a pillow under the baby's head and your elbow and then you feed the baby. When standing, please do not bend over your waist. If you have to bend, either you sit down and then you pick up that thing, or you put one foot in front of the other and then bend your knees to pick up or lift your baby or anything you want to pick up. When you're bathing your baby, again, don't kneel over your waist. Kneel down by the side of the tub and then bathe your baby. Again, you have to be very, very careful. If you are getting up from the bed or you are getting out of the bed, you have to move your hips and the back in simultaneously and in the same direction, so it does not strain your back. And these precautions that we are taking, it is due to the fact that the pregnancy hormones, they soften your ligaments, they soften your joints, and this softening occurs to facilitate the birth of the baby. But once the baby has been born, it takes some time for these joints, for these ligaments to get their strength back. And this is the time period where we have to be careful, because this time period is when you may injure your back. Now, regarding lifting or moving objects, there is a choice, either you push or pull that object. And preferably, you should always try to push an object instead of pulling it towards you. And even while pushing, it is best to use your legs rather than your back or your arms. Just be careful to use your thigh muscles and not your back muscles and your arm muscles. This was regarding women health issues, and we paid special attention towards pregnancy. If you have any queries, any questions, please just write them down in the chat and then we can discuss them at our allotted time. Thank you so much. Allah Hafiz.